All right, well, it's 7:01, so we'll go ahead and begin. I just want to talk to everybody about some of the features that you guys will have during this webinar. You can click on the screen at any time and leave little celebration notes. If you look on your bottom panel, there's emoji reaction. So if you like something someone says, show them some love, give them some emojis. If we also have a chat panel, so make sure that you're active in there. Go ahead and if you guys just want to have conversations with people during the webinar, and there is also a Q&A panel where you can ask questions, and we will be highlighting those questions on screen just like this. So feel free to ask anything. I am going to go ahead and pass it over. Thank you.
Good evening, everybody, and thank you so much for joining us again. I'm Nilcha Gedney. I'm the Executive Director of Home Dialyzers United, and we're bringing you these monthly webinars. And I'm just really excited tonight to bring you, we're going to have some fun. And this is all about diet and exercise. And nobody wants to talk about diet, and most of us don't like to exercise. But we're here to tell you that we're going to do this in baby steps. There's something for everybody. It's something that we can all do. And we've got a great group of people here to sort of get you inspired and encourage you. So with that, no further ado, I'm going to introduce each of our speakers, let them tell you a little bit about themselves, their interest in diet and fitness, and also relationship to kidney disease. So let's start with Brielle, and give us.
Okay. Thank you so much. So my name is Brielle, and I've actually been on dialysis for 33 years. I give a lot to diet and fitness for being on so long. I currently do home hemodialysis, and I've been doing that for the past 11 years. And I absolutely love fitness, anything to do with fitness. I love walking my dog, going to the gym, hanging out with family. But how I relate to kidney disease is that I actually had renal reflux. So that's how all of my kidney disease started back when I was 13 years old. So do the math. That's how old I am. But absolutely can't wait to talk to you guys about fitness and nutrition tonight. So thank you very much.
Great. And Cher. Oh, you're on mute?
I've got it.
There we go.
Now we got a bunch of other things spewed up. So that's okay. Thanks for having me today. I am a patient outreach coordinator for Renal Support Network. And I am also moderator during our fitness classes that RSN offers 4 days a week. They're low impact. We have 2 instructors 1 day a week and 2 instructors the other 2 days a week. So we have a nice variety. You can always learn something new from another instructor. And the way I got involved in Renal Support Network is I'm a dental hygienist. My kidneys failed 26 years ago. I had a transplant due to an autoimmune disease, and I did that. I had the transplant after I had been on dialysis I did PD for a year. I grew up loving exercise as a teenager. I was in all sports. And so whenever I was diagnosed with kidney disease, it was a big shock to my system. I thought, wait, how am I ever going to be able to play any sports again? And slowly but surely, by using low impact exercises, even though I have an autoimmune disease, I can do it.
Fantastic. Tamara, tell us a little bit about your background.
Sure. Hello. I'm coming to you from Canada today, and I've been a kidney patient since 2015. I'm not on dialysis yet, but I'm definitely headed that direction. My GFR is just 18 now. But they thought that my kidneys were going to fail in 2016. So we did all the transplant workup, and they didn't fail. And I totally credit nutrition and exercise and such a big change in how I approached both of those things for staying stable for almost 8 years now. So I'm excited to talk to you guys. Thank you for having me here. And other things about me, I guess. I'm kind of a foodie, so I do have a little food truck that we do once a week. And I teach fitness classes, including dance fitness, Zumba, a Bollywood dance fitness called Bolly X. And I'm a patient partner with BC Renal and the Kidney Foundation in Canada. And we have a wellness hub where we have classes, and I teach a gentle movement class on there as well.
And you actually credit having kidney disease and changing your career. You've added holistic medicine and fitness to your career as a result of having a diagnosis. Is that correct?
Yes. I had a very, I would, now that I know a little bit more, I had a very poor diet before, and I had no idea how to kind of turn that around. And so I did a diploma, and I have a holistic nutrition diploma as well. Forgot to mention. Thank you.
So speaking of diet, we'll ask Jennifer, our RDA, our renal dietitian, resident renal dietitian here, to give us her background.
Well, good evening, everybody. So I'm so glad to be here. Mel just said we don't want to talk about diet. That is my very favorite thing to talk about. I love talking about nutrition and everything diet and kidney disease. So I am a plant-based renal dietitian, and I'm not a kidney patient, but kidney patients are my heroes. And I've worked in kidney disease since 1998, so you can do the math with me too. That's a really long time. But I started in dialysis and worked for years and years there. And then when I was working in my master's degree, I started thinking, I live in the South. I'm just south of Memphis, Tennessee, as you can probably all tell by the way I talk. But I started thinking, like, why are there so many dialysis centers going up on every corner, and why aren't we doing something about this? And so I did all my research in my master's program towards that, and learned of things that they were doing in Europe that we actually were not doing here in America. And so I started working with pre-ESRD patients, then keeping people off of dialysis using low protein plant-based nutrition. And so then I wrote a whole book on that because I wanted to raise awareness across the board because these patients weren't being treated. And so I read the book Plant-Fed Kidneys, which was really written for practitioners, but patients read it. And so I just recently released my second book, Plant-Fed Kidneys for the Patient. So if you're looking for that on Amazon, it's for the patient. But anyway, it's just for patients so that you can know, if you're not on dialysis yet, how to stay off dialysis. But even if you are, which we'll talk about tonight, there's so many things you can do to preserve your health nutritionally and with exercise, and just that you can live a full life like these ladies here that are so inspiring are doing. And so I'm just excited to talk to y'all.
So with that, we're going to get started. And we already even have a question from someone who's excited to get started with nutrition and exercise. And the tack that we're going to take is, one of the things we always hear in dialysis is what you can't do, what you can't eat, and it's always in a negative. We're going to dispel that tonight, and everything we tell you is going to be what you can do. You can eat, you can exercise, and we're going to talk to you about how. So Jennifer, I'm going to let you start off with a little bit more in depth about the types of ways that you can adjust your diet and still be a foodie.
And still be a foodie. Okay. So here's what's interesting. Historical dialysis diet was so void of nutrients and bland and boring. Thank goodness in 2020, now this is in America, in 2020, the KDOQI guidelines changed. What is that? That is the national guidelines for nutrition. And guess what? Where there used to be this whole, like, you can only have this much phosphorus, you can only have this much potassium. That's not even the guidelines anymore. It's individualized to you and your lab. So you might be taking different medicines. You might be on a different type of dialysis than someone else. Your body responds to dialysis differently. And so you can include so many things in your diet, like fruits, colorful fruits and vegetables, especially if you're on home therapies, because you don't have you're going to get rid of more potassium. You can eat, some people can eat more phosphorus than other people. And so what I would tell you to do is, instead of looking at your diet as something restrictive, like I can't have this or that because my kidneys are not working. No, you are a whole person. You have a heart, you have a brain, you have a liver, you have arteries and veins. And so what I would tell you to do is eat for overall body health. Eat to make your body be the very best, healthiest person that you can be. And you happen to be on dialysis. And you can do that. So I encourage you to eat very colorful fruits and vegetables to nourish your body, to get antioxidants, lower inflammation levels. Eat a variety because that's going to help your gut microbiome be healthier. And then you know what I tell you to do? Enjoy your food. Enjoy your food because there's so much negativity around food with dialysis. And part of eating is just the enjoyment of it.
So Tamara, you know what? Why don't you jump in here with a little bit of your holistic viewpoint and maybe expand on that from a personal standpoint and what you actually eat and how you said you're a foodie as well.
I am, and I love what Jennifer just said, like finding that joy in eating. I think at first, when I was, very first diagnosed, it felt like I can't do this and I can't do this and I can't do this. And then the more I learned, the more excited I got about it. And yeah, I even got I got my boyfriend excited about it. He loves when can you have this? Can you have this? And I'll give him like a bunch of ingredients and he'll make a lovely meal. But again, with the variety, like Jennifer said, I mean, variety of foods is going to be a variety of nutrients. And it keeps you from getting bored. I don't think I ever used an herb in my life before kidney disease. So I'm kind of thankful sometimes for having this. Like, I don't want kidney disease. It sucks. But it's gotten me to eat differently and to, when you eat really well, you feel the difference and you feel really well. So I use things like I love spices. I'm not always, grating my ginger or crushing my garlic because you can almost always find a dried spice that you can add to your food. I don't look for the blends. I don't like some of those have additives or a lot of sodium. So just like a pure spice. And yeah, using herbs and using different things to flavor my foods, I think is a big thing. And yeah, just that variety. I love trying new recipes. I like challenging myself to make different things. I'm a very ethnic eater, so I'll try a lot of different cuisines. And, most of them are hits. Every once in a while you get a meal that you're like, doesn't taste very good. But, for me, it's gotta taste good. It's gotta be appropriate for my kidneys, maybe satisfy hunger. All the factors aren't always there, but those things are really important to me.
Great. How about Brielle? Do you have any tips and suggestions for how you eat healthy?
So as far as food-wise and supplementation, because I use a lot of supplements, especially for protein, and my center tells me I always have the highest albumin. But what I do is branched chain amino acids. It comes in a powder and it's fermented from plants. So there's less waste there's hardly any waste that your kidneys have to produce. Well, I don't have kidneys. So in this case, the machine, but it has really helped me as far as keeping my albumin up. It comes in a powder or it also comes in pills, like a pill form. But supplementation for me is very big.
And part of that is because you also have a very strenuous weightlifting and bodybuilding fitness program that most of us don't. But again, you've made that adjustment to make sure that your body stays in balance.
Right. Yep. So yeah, I really like to work out. I think we'll talk about that later on. But yeah, I used to compete on dialysis. So I was trying to get as much, thanks, Jennifer. I was trying to get really, really high quality protein. And the branched chain amino acids, when there's less waste, I feel so much better. And then again, like eating more vegetables, fruit with that. There'll be times where for breakfast, I'll just have a branched chain amino acid drink. So, and then not eat lunch until later on. So, yeah.
And Cher, you have a little different approach. You're a pescatarian, right?
I'm a pescatarian,
That is
and
really
I
cool.
just kind of stumbled into it. Whenever I was in dental hygiene school, part of our curriculum was nutrition, and that was indeed part of my board certification, that we had to have nutritional education as well. And I didn't know I was at risk for kidney disease, but I saw changes. I wasn't feeling great, and I started just eliminating certain things from my diet. The first thing was chicken. The next thing was pork. The next thing was steaks. And, I thought, you know what? I could probably just eat fish and vegetables and fruits and watch everything, make sure everything is balanced, right? And that I would be okay. And whenever I was diagnosed with kidney disease, I found out that I probably helped delay my kidney disease. Now, this wasn't in today's society. This was 25 years ago. And whenever I walked in, the dietitian thought, oh no, what do we do with her? Because that was not the science at that time. And, I was so fortunate because she didn't try to get me to change. We just continued. We watched my labs, like Jennifer said, hey, if it's working for you, keep on going. And I was very fortunate that I knew what phosphorus and potassium were. And so whenever I went in 25 years ago and they gave me 3 sheets of paper, one was red, one was yellow, one was green. And to me, red means no. But I was like, this is part of my diet. As long as my labs are okay, I'm still going to go ahead and do it. And today I tell patients, you know what? That doesn't really mean no. Even if they give you a red sheet, barter.
Yeah.
Try and find things, can I have it once a year? Can I have it on my birthday? Can I have it, once a month? Can we watch my labs and see?
Mm-hmm.
Don't deprive your don't
Deprive.
don't deprive yourself. Here I am getting tongue-tied, of things that you really enjoy if you don't have to.
That is correct.
You'll
I have a little anecdote I'm going to just throw in here. I promise not to talk too much, but when the question is, what does a renal diet look like? And we've all talked about what we can eat. We had a member of our group that is in rehab, and they sent her the renal diet on her tray one night for dinner. And she took the lid off and she looked and she took a picture and put it in our group. And it had a piece of white bread and a thing of white rice. And that was it. It was, yes, that was what they interpreted in the rehab facility as a renal diet. And obviously none of us are going to survive, just as Jennifer said earlier, and Cher back in the 80s, this is not what we're looking for. We all can, those sheets that they hand out, I get a little annoyed myself. I'm kind of like, the most important thing to me is that we avoid the processed foods, the sodas, the things that are truly bad for our kidneys, but nobody should be eating them. And not just people with kidney disease or on dialysis. And after that, it's a matter, moderation. We all are doing different things and, that fits our body. I, for one, have only eat one meal a day. I mean, I've been like that for years. That is what works for me. And so even if that meal is 100% phosphorus, it still is not enough to throw my numbers off because I'm only eating one meal. So we're going to move on and we're going to talk a little bit about how do you stay on a renal diet, but we're not really staying on a diet. We're just making it work for you. So let's address that. Jennifer?
Yeah, so I don't like the term renal diet. I don't think that exists anymore. And I'm trying to undo that. The problem is those old KDOQ guidelines that I told you about, they still hang around. And that's why your friend got that tray, which is horrible. tell me your question again. I was hung up on the
Oh,
truck.
about, not only how do you stay on the renal diet or per se, but how do you make a diet work for you?
Okay. So know your body, know your labs, know what tends to run high. Also, there's things that we don't talk about a lot, especially with dialysis patients. So I speak for another company. The whole thing I speak on is inflammation. So we always want to, because the dialysis process is inflammatory in and of itself. So we want to lower inflammation. So other things that you can do to know if is what I'm eating, like, is it working for me? Besides labs, you've got labs, but you've also got things like something that Brielle could relate to, like, am I preserving muscle mass? Do I feel like I'm getting weaker? I'm losing muscle mass. So yes, you need protein, but you don't have to eat animal protein per se. You can eat plant proteins. You can do supplements. I love Cake Farm's supplement because it's got lots of phytochemicals from fruits and vegetables in there. But lowering inflammation is going to keep your albumin level up. If you're inflamed, your albumin level is going to go down. How can you know that? Do I have joint issues? Am I losing muscle mass? Things like that. And is my acid-base balance in track? Look at your bicarbonate level. Is that on track? Because if not, then you're going to be breaking down your bones, breaking down your muscles. So those are things. So you'll need to eat more fruits and vegetables to be more alkaline. So knowing your numbers and having that motivation and knowing your body. So I know, okay, I can't eat this. This kind of throws me off. I'll do that. And I'm not a kidney patient. I know, if I eat a certain food, I'm going to feel bad because I listen to my body and I know my body. What I would tell you is we want you to have good labs. We do. But we want you to feel good. So if what you're doing, if you're eating a lot of processed junk food, you are not going to feel good. I want you to live a full life. I want you to do like Brielle and go do, weightlifting and tomorrow teaching classes and share, over the classes in her group. I want you to get out and move and have energy and feel good. Because dialysis is not, something that takes away life. We want you to still live life. So know how you feel, enjoy your food, know your own body and your own labs, and let that be a motivator to keep you going. And then think about, what is it that I want to do? Do I want to run a marathon? Or do I just want to be able to make it through a yoga class? Either one of those is fine. But the way you eat is going to affect that goal. So keep that goal in mind, what you want to do. Maybe even write that goal down so that you know what you're going for. That goal could just be you want to play with your grandkids and you want to have energy to do that. And so write that goal down and then go, if what I eat today, is that going to get me closer to that goal or is that taking me away from that goal? The goal is life.
And Cher put a great comment in the chat, and I want you to expound on that because all of us, people, a lot of times it's hard for us to cook. I live alone, so cooking for one is hard in the first place, and then you have to add these restrictions. So, but there's ways, online groups, different cooking schools, classes. I've become addicted lately to Pasta Grannies, which is on YouTube. It's an absolutely fascinating show of ladies in their hundreds doing homemade pasta in Italy. Whatever it is, you got to find that. And right. So Cher, talk a little bit more about some of this nutrition and exercise that they offer at RSN.
Sure. Kidney Kin Foodies is a food support group for people with kidney disease. Lubna Akbani is a renal dietitian who has done dialysis. She's also had a kidney transplant. And, I've had my kidney transplant now for 24 years. If you know anybody who's had a transplant, it's hard to keep the weight off. It is so hard to keep the weight off, and lots of people come trying to get their BMI down so they can qualify to get a transplant too. So, besides the fact, the cardiovascular benefits of it. At the Kidney Kin Foodies class, what Lubna does is she's not teaching a class you're not sitting there listening. We're having an interaction, and people are asking her, well, you know what? I just discovered this new food. Does it fall within the renal diet? Now, she can't counsel anybody because she doesn't have anybody's labs. They're not her patients, but she can give generalized answers and give them good resources. And if they need to discuss to, their renal dietitian to find out what's appropriate for them, she does. But we come up with lots of new foods, new uh, tastes and flavors. It's great because we're having a discussion. Something that I've done that I just kind of stumbled into is, during COVID, lots of people were cooking. I probably cooked less during COVID. I didn't eat quite as much. I wasn't out doing things, but we started the exercise class with RSN. And so I was able to maintain my weight during COVID, even though I wasn't probably eating as well then as what I should have been. But life's a balance, right?
Yeah.
I mean, that's what it's all about. And at the end of COVID, though, and it's not technically over, but as we're getting out and we're seeing more people, I reconnected with a friend of mine, and she's been baking sourdough bread over, during the pandemic, and she gave me a starter. And I have been able to cut down my sodium even more than what I had before. I'm salt sensitive, so I have to be very careful with my blood pressure. But I've been baking sourdough bread. I've been making sourdough pizzas, and I've got control of the sodium completely. I can keep it down low. I can make a pizza with 5 grams of sodium.
Yep.
Sourdough bread.
That's great. And Bree, tell us some of you talked about your supplements, but what do you do for actually when you're cooking?
So I really like to meal prep. I find, I always have a busy schedule with pet sitting. I am a pet sitter, a patient advocate for HHD, and I help my dad at his supplement store. So if I meal prep, like on a Sunday, I'll use my crock pot. I'll get like a big pot and just put all kinds of vegetables in it. Make a lot of soups. That's a really good one. Get everything in there. And like Tamara said, I use different spices just to liven things up. But yeah, and then also with my supplementation, the supplements, I'll make different kinds of protein shakes. It could be plant-based. Sometimes I do whey protein, but I'll just do different kinds of recipes of protein shakes. Wow.
Fantastic. And Tamara, you mentioned using herbs a lot. What are your favorite foods? What do you like to cook?
Oh, I love Indian food. Part of my background is Indian though. So I love a lot of Asian cooking. I find it's easy to have a lot of vegetables in one dish and make it taste really, really good. I like rice noodles, so that goes along with vegetables in many things, including soup, or like a Vietnamese dish with a whole bunch. You could, put your favorite vegetables. It doesn't have to be. There's not one way to make, ramen, or one way to make a Vietnamese bowl or stir fry. You pick your favorite vegetables, and I'll even use frozen vegetables, especially through the winter when they're not in season.
Right.
Just because, have you ever, I love cauliflower rice, but have you ever tried to stick that thing in the blender? It's a mess, right? I'll buy it frozen, but I used to think that, it wasn't fresh or wasn't as nutritive. And then I, learned that no, it's harvested when it's at its best, and it's so convenient to add that. And I might mix it with rice or just have it on its own. I might make noodles out of zucchini or out of spaghetti squash, or I might have noodles. There's nothing wrong with having the rice noodles either, right? I also, up here, oh my gosh, we have a sourdough pasta in BC, and it's so good. So if we're having a pasta dish, I like to use. Yeah, it's good stuff. And then other things, I really like Greek yogurt because it's so versatile. You can put it in a smoothie. You can go sweet. You can go savory. You can go saucy. You can even use it as like moisture in your baking. So I really like, I really like things that have more than one use, and that, sometimes they don't tick all the boxes. Maybe I'll have tofu. I do eat meat, but I don't eat a lot of it. So I might have a little bit of chicken, or I don't eat a lot of beef, but I'll eat like a little bit of chicken or a little bit of fish. We have a lot of fresh fish. I live on Vancouver Island. And just like, I don't know, I like when it's colorful, and I like when meals look good. It doesn't take a lot to kind of pretty them up, and add some green onions on top, or throw on a little parsley on there and decorate it. So yeah,
I think stir fry is like my go-to dish, but we're going to switch from food now and go into a little bit more on exercise, because in all honesty, I'm going to tell you, for me, that's the most daunting. Unlike you, Brielle, I never liked exercise. not from, being when I was a little kid. But as I got on dialysis, and I did notice that there was muscle wasting. So and this is a really important topic, make sure you're entitled to do PT with Medicare. They will pay for up to, I don't know how many, it's usually about 3 months worth. And I did it twice in the last 10 years that I've been on dialysis. And it really helped me at times when I was either had say an illness or some inflammation that was a real setback, get my strength. And then I adapted it as I got, later. And now my favorite is working out in the water, because for me, that's painless. And so I do a water aerobics type exercise in my hot tub almost every night. And that's just been a lifesaver. So I'm on each of you we're going to talk a little bit about how you added exercise in your life to make it work, something that made you feel good. It doesn't have to be a marathon, but it can be competitive weightlifting. So let's start with Jennifer.
Okay, so I'm kind of like Brielle. I love exercise. And we have a similar background with weightlifting and all that. So I absolutely love it. And I've exercised since I was very young. I'm not an athlete. I'm totally uncoordinated, but I exercise. So, but I want to talk less about me and more about if you are an in-center hemodialysis patient. I want to talk about the experience that I had in the dialysis centers. So this is how important I think that exercise is. Let's say you're in the hospital and you get bedridden for a week. It is crazy how fast you lose muscle mass in that situation. Now think about, particularly if you're an in-center hemodialysis where you're sitting 3 weeks for 3 to 5 hours. That does not contribute to muscle gain. It contributes to muscle loss. So what I did in my clinic was I went out and I bought those peddlers for my patients out of my own pocket. That's how important I think it is. And I put it at the foot of their chair. And anybody that would, I didn't make them. I said, if you will, will you pedal this bike while you sit here? Because I don't want to see your muscles waste away. And then I had another lady who was falling. And that's very common as we age. And so strength training is so important for everybody. On dialysis, not on dialysis, everybody. Strength training is so important. And so I would just put these little leg weights on her legs. And while she sat there, you could do this while you're doing a PD exchange, a hemodialysis treatment, and just lift your legs with those little leg weights on and just stimulate that muscle. So, and one other thing that I would recommend, and Cher can talk about her classes. I think you said y'all have yoga classes, but yoga is really good for balance. It's good for your mental health too, but I'm going to focus on balance, because another thing, just falling as we get older is a big, huge deal, because you can break bones that way. And so even just doing yoga to help with your balance. So all those things are so important. I hope if you're not exercising, you'll start with just some small steps. Just small steps make a huge difference.
And Cher, why don't you share some of your resources? Because we're not going to reinvent the wheel. Well, you guys do over at RSN do such a great job that we would just want everybody to know what you have available.
So all of our classes, our instructors are prepared to help patients adapt. So it doesn't matter if it says chair yoga or not. If you need to sit during a class, they will adapt the exercise to what your needs are. which is really awesome. And we have an instructor on Monday and Wednesday who gears her classes. It's more of a Pilates, some yoga type classes, but she will, if you're just beginning, especially, right, whenever you start exercising, you don't want to overdo it, injure yourself, and then not be able to continue. Classic mistake. Then on Tuesdays and Thursdays, we have a chair yoga class, and it's fabulous. Those instructors are really keyed in with giving patients suggestions on what they can do, even whenever you're waiting for a doctor's appointment. You're sitting out there and you're all frustrated and you're worried, and they give you suggestions on things that you can do while you're waiting, so you're not wasting time. Isn't that great that you can stick it in? One of my best friends, who also has kidney disease, always suggests to people that you start out small. I totally agree with that. Whenever I started exercising again, I had to do the same thing. It's hard whenever you have kidney disease. I have an autoimmune disease. All my joints ache all the time. And, for me, low impact works. I don't injure myself so I can keep going. But my friend, what she tells people is if you start out small, even if it means just walking to your mailbox, right? Start out small and then build on upon that. And if it's too much, then you can back up a little bit, but don't give yourself a hard time. Don't beat yourself up. It's okay. You do the best that you can on any given day, and that's what we all do. That's what we all
start with baby steps, and just go from there until your whatever your tolerance level is. So Tamara, you want to jump in, because you do fitness training too.
I do. I want to love doing strength training with weights, but I don't love it. But I do it from time to time, and I need to do it more. What I have found is that finding the movements, finding the things that you like to do. It doesn't have to be, a huge thing. It doesn't have to be a marathon. It can be if you want. But finding what you like to do. If you like to walk, I've found that I like to dance. It makes me happy doing the Zumba class, whether I'm teaching or participating. And yeah, I just, I'll end up doing that a few times a week. And walking my dog. And yeah, it's very easy because I like it. I do a little bit of yoga just because it helps ease some pain. So there's always some sort of motivator behind the choices I make. It's usually something I like, again, like making food choices, or something that's going to serve me in some way. Easing pain, or helping me be stronger, or be able to stretch more, or allow me to do even everyday things. Allow me to do things that, to carry my groceries, or, simple things like that, or carry, things around the house, or fix things. Just, there's always some sort of motivator behind it.
So we've all talked about how we've made exercise a part of our lives. And I'm just curious, have you always done exercise? And we've talked a little bit, but maybe go into a little bit more of when you started, and, did you actually have a goal in mind, or did you set goals? Have any of you done PT or received help from other people? Cher, why don't you pick up on that?
I think I've done every kind of PT that's available.
That's great. I mean, that's
I have chronic pain, and so I've looked for, in addition to that, acupuncture, reflexology, all types of palliative type care. That even though if you're not moving not acupuncture but chiropractics, right? If you're not moving and somebody else is, that's still helpful, because as you get more range, more range of motion, you can do exercises more comfortably. So that's important. And for me, I already had a motivation to fit in my clothes better. Scale doesn't matter to me at all. I could care less. I want my clothes to fit and I want to look good. And I look at the scale to be sure that I don't gain more than 3 pounds in a day. That's it. And, I'm careful looking for swelling because sometimes it's not extra pounds, right? It's swelling. And so those are just things that for me, um, I just try to do my best every day. I walk, I play with my dogs, I garden. I don't do any hardcore exercises like I did until I was into my 30s. I love it, I miss it. But with my chronic pain, I do what I can. And so for me, I've had to do a mental adjustment in my head and say, okay, Cher, don't overdo it today. Take it easy. Maybe instead of, being out in the garden for 2 hours, I'm only out there for an hour. But I have to be careful with, sunburn too. So, it is, you take all those things into consideration. You get out, you do what you can, you get, motion points, right? I learned in physical therapy, even if you're vacuuming or cleaning the house or doing gardening, all of those things count towards exercise. So don't cut yourself short. You may already be exercising and you may just need to pump it up a little bit.
And you brought up a really good point about using the resources. I mean, first off, the ones that RSN offers, but also when you want to get started and really are kind of afraid. I mean, I know I was, of hurting myself. I hadn't been exercising in years. I felt so bad before dialysis that when I got on dialysis and felt great, but using PT, physical therapy as a resource is something that should be encouraged for all dialysis patients. And don't be afraid to ask your clinician to prescribe it, even every couple of years, just to update, because your body changes over time as you age. As I aged, I needed a different focus, which is why I went towards water, because for me, that's the only way I will exercise. It doesn't hurt. So
right. No, it doesn't. And I use a Fitbit because motion is the key. Keep it moving.
Keep it moving. Yep. Get up. And mine tells me to get up, and I sit at the computer all day, and it tells me to get up every half an hour or an hour. So, Bree, you probably have some good things to add too. With setting up a routine, how do you keep it going?
Yeah, and it's just to find something that you like.
Yeah.
Even if it's just walking, bouncing on a ball, like one of those big exercise balls. I love doing that. It gets the heart rate up, the blood pumping, the lymphatic system going. I absolutely love doing that. And if you don't have one, just go on the edge of your bed and do it. But when I first started working out when I was around 14, 15, I wasn't into it. My dad showed me and I was just like, and it was with weights and machines and stuff. Then when I was around 19, I don't know, I just, all of a sudden, I loved it. I loved how it made me feel. And, I was on dialysis for several years, but I just felt so much better. My joints felt better, and I wasn't lifting heavy. I was doing, and pretty much to this day, I do the same, low weight, but very high rep. And that has got me really good results, putting muscle on. And I like to work on my balance too. Cher was saying, and you were saying too, like balance. I even noticed, in my 40s, my balance being a little off. So I actually got a personal trainer and we worked on balance and exercises like that. That's all we would do, like one day out of the week. So, but yet exercise just has really benefited me in so many ways. It just makes me feel so much better while I'm, doing dialysis and on everyday level.
So I'm guilty of this, and I, you know, it's easy to make excuses. I'm tired tonight. It's cold. I don't want to go outside. How do we get past those excuses, or how do we, you know, motivate, keep ourselves going? You know, I don't mind missing one night, you know, or one day of exercise, but when it goes into 2 or 3, I start to feel it. And then, you know, I'm just trying to think how we can help people understand in the audience to, when they start, to just, again, keep that motivation going. Are there any tricks that each of us use tomorrow? What do you?
Oh, that's a tough one.
It is.
I mean, you could take a hard stance and say, okay, this is a non-negotiable, and just, you know that it's part of your routine or your day, like brushing your teeth. But that doesn't always work for me. So I always revert back to, what do I like to do? And it doesn't have to be big. It doesn't have to be all at one time either. You know, they have certain guidelines out there. You always hear, oh, you should do this for 20 minutes, or this for 30 minutes, or this for 60 minutes. You can do something for 10 minutes, and you can do it a few times a day, or something different later on. So just breaking it up a little bit sometimes when I'm really feeling really defiant about exercise. I do have, I am a fitness coach, but I also have a fitness coach, and I like that he kind of keeps me accountable. I'm not much of a tracker. I'm more with relations with people, and we'll sit down and have a coffee, or he'll say, what have you done this week? And then he'll say, okay, well, where can I help you? So I sometimes like to just, talk to other people, because other people often face the same things. And then the last thing, I guess, would be is group exercises. If you like doing things with other people, sometimes that's what I find is a group class, just taking in that energy of the other people around you, can sometimes be really motivating as well.
So Jennifer, you used to work with people and exercise in the clinics, and how did you get them? What happened? Did they ever come in and say, I just don't want to do this today?
They did. So yes, that did happen sometimes. One thing that I would say, just on a day-to-day basis, and this is a quote, and it says this, and I think this is huge for diet or exercise. I'm going to read it to y'all. It says, you do not rise to the level of your goals. You fall to the level of your system. Your goal is your desired outcome. Your system is the collection of daily habits to get you there. So kind of like what Brielle was saying, I meal plan. That is setting up her system for success. She's already got the food there ready to go. So my husband is actually recovering from cancer, and he had radiation on one side of his body. So his right shoulder is really, he's trying to get his strength back. On his side of the bed, he has weights laid out. That is his system. When he wakes up, it's right there. He can put on his shoes. It's right there, and he does it right then. He makes it easy for himself. So think about that, setting up your system for success. Also think about, how can I work this into like just what I do every day? So if you look at, there's these groups called blue zones. These are areas where people are really, really healthy. They have a large number of centenarians, people that live to be 100, but they're healthy 100s. They don't have to go to a gym or have to go to, their life has movement in it. So I tell people, have exercise snacks. If you sit at a desk all day, every hour, get up and walk 5 minutes. Just around your house, outside, around your office, wherever you work. I work from home. I sit at a desk, have exercise snacks. I walk and I have a dog that makes me walk. I think Cher, we're talking about dogs. I have a dog. If I don't walk him, get you a dog. There's a solution. But I'll walk him to the mailbox and back, because if I don't, he'll tear the house down. So set your system up for success, work it into your daily life, and get a dog. That's my tip.
I just to talk briefly about that, one thing that I found just by accident, we all suffer often from restless legs, especially if we're on dialysis. And so when my hot tub was broken or down for maintenance for a little bit, and I wasn't able to do my normal exercises, I found the restless legs came back. So I was lying in bed, I was watching TV, and I, started to feel the symptoms of restless legs. So I started doing the same leg lifts that I was doing in the hot tub, up and down, back and forth, bicycle type, and just kept doing repetitions. And I found that it made the restless legs go away. So I do that now, if I'm at night, if I miss, either like, especially when I travel, I may not get into the hot tub. So then I can at least do that. And that's in bed, lying down just before I go to sleep. So, I guess there's always, where there's a will, there is a way. But I will be the first to tell you that taking that first step is so hard. So, I'm really excited that we have offered all these resources. RSN is, really pioneered the way. Jennifer's got these great books, especially for diet and exercise. And I think everybody just a few parting words, of encouragement for the audience, how to help them take their first steps. So, Tamara?
Sure. A few parting words. I would say the same thing for nutrition and diet as for exercise, is start small. You don't have to make 20 of your meals every week. Start with one home cooked meal and go from there. And likewise with exercise, start small, find something you like to do, and don't do it like all the time. You don't want to get tired of doing it, but just find something that you really like.
Great. And Bree? Oh, you're on mute for some reason. Mute.
Sorry about that.
Oh, that's okay.
Yes, just find something that you love to do, whether it be dancing, walking, even like sometimes I'll just be brushing my teeth and I'll just do body squats while I'm brushing my teeth, or little arm circles. Get your arms out, just some kind of movement. Doesn't have to be huge, doesn't have to be weights. Bands are very popular too. And while you're sitting there watching TV, just do some curls or yeah, that's probably the easiest, out of all. Yeah, I just want to encourage people out there, just find something fun to do. And once you start it, it's that initial step.
Exactly.
And, once you start and you keep up with it, you'll start seeing results. And that's what keeps me motivated, is when I see the results. So.
And Cher?
Yes, thank you. So I missed out on making the comment about how you keep going whenever you feel tired. So I'm just going to sandwich that in real quick, and I won't take long.
Absolutely.
But, I wanted to encourage people, don't beat yourself up.
Yeah.
Whenever I was on dialysis, I said I was a dental hygienist. There were days I did not want to brush my teeth. There were days I was so tired, I didn't want to get out of bed. Don't beat yourself up. There are enough people in the world today that they are unhappy, and they will do that for you. Don't you beat yourself up. And so I put in the chat that RSN offers support groups twice a month, which is a wonderful thing. People are so supportive of each other. And it's great, just like this meeting, people are encouraging everybody else within the kidney community, right? I mean, we stick together. We are brothers and sisters in kidney disease. But what I haven't talked about yet is Lori Hartwell, and she was invited to do today's presentation, but it is her 25 year
wedding anniversary,
a big one, right? So she is off having fun. But Lori is quite the genius in that all of the RSM programs, they're not just exercise and nutrition. every one of those are support groups. You know, people come into support group and they're like, so how's your back doing? Is it getting any better? How's your kidney doing? You know, I had retina surgery. I mean, people, they're not just there to exercise, they're there to support each other. And that is the message I want to give today is that don't beat yourself up, keep your spirits up. And
Right.
depression is how, whenever we're at home at night, we don't want to exercise. That could be depression. It could be anxiety. You know, ask your doctor, hey, are my labs off? Or, you know, whenever I am tired, really, really tired, and I don't exercise for a couple of days, I feel sluggish. I feel like I have no energy at all. And I know I'm not the only one in this position. So, you know what? I give myself a few minutes to brush myself off and go, you know what? Let's get up and get it again. And just don't stop. Don't stop. Don't ever stop. Just keep going.
That is so true. And I'm so glad you brought up about the depression and a little bit of, you know, mental health, because we all go through those periods sometimes when we've, you know, had a setback. And exercise, you know, can be actually one of the best ways to help pull yourself back out of that. It helps, it physically, it actually releases endorphins. I'm not sure about Jennifer, you can talk to the physical aspect of that. But you know, there is a actual medical reason for exercising and keeping your body moving. Jennifer, did I miss you, or you want to summarize?
You
Okay.
Okay.
Finish up with the professional aspect, because
For exercise, I'll give that, but I have to give my parting words too. But yes,
Please.
it raises endorphins. Things that with yoga is fascinating. I feel like I'm some big yoga expert. I'm really not, but I will tell you this, that I do know that yoga will bring up your parasympathetic nervous system. That's the calming system, and bring down that sympathetic. So it helps with your brain. Cardiovascular exercise, even weightlifting can be cardiovascular because it gets your heart rate up. That is going to release your endorphins. So, and then for my parting words, I'm sitting here thinking before all of you that are watching were we were listening to Rocky, okay? And so I'm thinking about Rocky. Let me tell you something. Every one of you is a champion. Now, you may not feel like that today, but you are to me. And do you know why? When I listen to these three ladies talk, I am so inspired. And I have been inspired by people with kidney disease my whole adult life. This has been my life's work. You are like Rocky because you are a champion, okay? You are a champion. Here's what you're a champion. You get knocked down over and over again. And what do? You get back up. You get back up and you do it again. I've seen you do it. Tomorrow, if you get knocked down, you get back up and you do it again. And you believe in yourself. The other thing that boxers have is they have a corner man. They have somebody that backs them up when they have to go in the corner and they feel like they can't go any longer. There's somebody in that corner that says, yes, you can get back out there and go again. So you make sure you have a corner man or a corner woman. And if you don't have one, you find me and call me and I will be your corner woman. But there's so many support groups like Cher mentioned. Have yourself some corner people that are going to support you on those days that you get knocked down. But you be the healthiest you that you can be because you're worth it, because you're a champion. And I believe in you, even if no one else does. And it's been an honor that I could speak with you tonight. Thank you.
I don't think we could end on a better note. Thank you, everybody. It was absolutely a wonderful discussion. And I hope everybody, you know, makes at least one change in their life. Have a great evening. Look forward to seeing you next month.